A referee changed the outcome of a soccer match, one decision, one red card, one moment that changed everything. But the bigger question was, who really controls the outcome of the game? The players, the coach, the referee, or the system behind the referee? Healthcare faces the same question. Every medical practice has an invisible referee. It exists in payment rules, insurance processes, documentation requirements, claim reviews, and increasingly artificial intelligence systems. These invisible systems influence whether practices get paid efficiently or spend hours fighting administrative battles. The uncomfortable truth: many physicians are not struggling because they provide poor care. They are struggling because healthcare has become a complex system controlled by processes they cannot easily see or understand. Physicians trained to heal patients were never meant to become experts in paperwork. Yet today, running a practice requires clinical skill, operational knowledge, financial awareness, and technology. A doctor can make the right diagnosis, provide proper treatment, document correctly, and still face denied claims or delayed payments. Why? Because healthcare is no longer just a clinical system. It is also an administrative system. Here is the question many practices should ask: what if your biggest financial opportunity is not finding more patients, but recovering the value from the patients you already treated? More volume does not guarantee success. Revenue leaks through. Delayed payments, denied claims, documentation gaps, inefficient workflows. The problem is often not working harder. It is lacking visibility. Doctors use data to diagnose patients. Practices need the same approach to diagnose operational problems. Where is revenue being lost? Why do the same issues repeat? Which processes slow the team down? This is where artificial intelligence enters the conversation. The question is not, will AI replace physicians? The better question is, will physicians who understand AI have an advantage over those who ignore it? Technology has always expanded what doctors can do. I should help practices reduce repetitive work, identify problems earlier, improve decisions, protect time for patient care. The future is not human versus machine. It is human intelligence supported by machine capability. But AI alone is not the solution. A broken process with new technology is still broken. The winners will not be those who simply buy the newest tools. They will be those who understand where technology creates real value. Medical billing is not just a financial function. It is a window into the health of the entire practice. It reveals whether workflows, documentation, and operations are working effectively. The future physician will need more than clinical expertise. They will need operational awareness. They will need to understand the systems influencing their practice. Because protecting physician independence requires visibility. The invisible referee is already here. AI is already changing healthcare. The question is, will physicians shape the future of healthcare technology, or simply react to decisions made by systems they do not control? The future belongs to physicians who combine medical excellence with operational intelligence. The soccer debate was never only about a red card. It was about trust, transparency, and confidence in the system. Healthcare faces the same challenge. The answer is not rejecting technology. The answer is using technology with purpose. Physicians and clinic owners, what is the one administrative burden you would eliminate from your practice tomorrow? Share your experience. Your answer may help another physician facing the same challenge. Healthcare improves when physicians stop accepting broken systems as normal and start building better ones.